You are not alone. Local chaplains are sharing that with patients who are nearing the end of their life. No doubt these are trying times, but especially for families who cannot be with their loved ones inside of a hospital. KCTV5's Emily Rittman spoke to a local chaplain with 20 years of experience about how comforting people right now has changed.
Our community is turning blue tonight for the Light It Blue campaign to salute the brave men and women fighting COVID-19 every day. Chaplains around the metro are supporting those frontline workers, their patients, and their families during unprecedented times. For safety and to stop the spread, our cameras cannot go inside the University of Kansas Health System right now. Their employees are sharing this video with KCTV5 News. Every day, hospital chaplains are working to bring comfort to those who are critically ill while facing new obstacles. Chaplains see firsthand life's fragility while trying to offer hope.
I've been part of a family meeting regarding an end-of-life situation where we did the family meeting on Zoom, which was very different than having the family around the bed or in a family waiting room to have that conversation.
For the first time, they are often not able to be physically close to patients and families when offering support and encouragement.
There have been a number of times I've had to stop myself. You know, if someone reaches out their hand for prayer, often when I might reach out and touch someone's shoulder, or if it were appropriate, offer a hug, that we simply cannot do right now. Losing a loved one under the best of circumstances is devastating, and then to have this extra layer on top of it means that, yes, we're having to do a little bit more.
They are using technology, including iPads and phones, to help patients feel connected and less isolated.
There are exceptions that allow families to be here in very limited numbers at the time that someone is nearing the end of their life or has died. There are families that are choosing not to come to the hospital, and it has been very difficult for them.
When someone calls for a chaplain, they are taking steps to meet their spiritual needs as best they can during this pandemic.
The chaplain has sat as close as they can outside the room where they are visible. You know, if the curtain is pulled back and the little window is at an angle where they can see into the room, and the nurse has taken, the iPad or the phone in, and then the chaplain has prayed from outside the room so that the patient and or family can hear them.
Chaplains are also working to keep our frontline workers healthy by being there for them to encourage self-care. Reverend Riegelman says the resiliency she's seeing is inspiring.
I think I feel more connected to my purpose at this time. Somehow being here and being in the midst of all this with everyone else that's dealing with it is giving us, I think, collective strength to be able to be in this time of uncertainty.
Emily Rittman, KCTV5 News.